They don't say it to your face, but you feel it. That quiet pause when the doctor sees your chart, the rushed tone, the way they speak just a little too slowly, the way they stop listening before you've even finished your sentence. It's not always obvious, but it cuts deep, because whether they say it out loud or not, the message is clear. You are old now, and to them, that means you matter just a little less. If you've ever left a medical appointment feeling ignored, dismissed, or invisible, you are not imagining it, and you are not alone. Today, I want to speak directly to you, the women who have given decades of care to others, only to find yourselves treated as burdens when it's your turn to receive it. This is not just about medicine. It is about dignity. It is about being seen, heard, respected. What you are about to hear may hurt, but it may also set you free. Because when you understand what is really happening behind closed doors, and more importantly, how to protect yourself, everything changes. You know, the first thing that really opened my eyes was how early the judgment starts in the exam room. Not when you speak, not when you describe your symptoms. No, it happens much earlier than that. It starts the moment the doctor looks at your chart and sees your age, 68, 76, 82, whatever the number. It instantly begins to color how they see you, not as the individual sitting in front of them, but as a type, a category, a senior patient. And from that moment, something shifts. Maybe you felt it before. That subtle drop in tone, that rushed look at the clock, that sense that they've already decided what this visit is going to be before you've said anything at all. It's not always said out loud, but it's there, in the way they interrupt, in the way they simplify, in how they listen less and assume more. You walk in with valid concerns, real changes in your body, but they don't always see you as someone to investigate. They see you as someone to manage. They've already decided. You're probably tired because of your age. Your aches must be arthritis. Your shortness of breath must be anxiety or slowing down. It's not always done with bad intentions. In fact, many doctors don't even realize they're doing it. But the system trains them to prioritize speed, to simplify the complex, and to view older patients as resource-intensive. That means longer appointments, more medications, more time, and to a system under pressure, that becomes a problem. So instead of diving deeper, they pull back. Instead of exploring your symptoms, they streamline. And that's how dangerous conditions get missed, or worse, completely ignored. I want to share a story. A woman named Maxine, 74 years old, sharp as ever, had been tracking her symptoms for weeks. She had chest pressure, shortness of breath, and fatigue. She came prepared. Notes, dates, clear patterns. And the doctor? He barely looked at her list. He cut her off and said, "Let's stick to one concern today." When she tried to explain that the symptoms were connected, he sighed and told her not to overthink it. He told her it was anxiety. 6 months later, she was finally diagnosed with heart disease after another doctor took her seriously. By then, damage had already been done. Now imagine if Maxine were 50. Do you think her symptoms would have been brushed aside? This is the quiet harm of unconscious bias. It doesn't scream, it whispers. And the danger is, when it happens enough times, even strong women start to doubt themselves. So how do you protect your voice and your health in the face of that? You start with clarity. Instead of saying, "I've been tired lately," say, "My energy has dropped by half over the past 3 months. I used to take a daily walk. Now I get winded after 5 minutes. Something's changed." You come in prepared. A single page with your key symptoms, clear, brief, confident. Not because you owe them proof, but because it helps you stay grounded when the conversation shifts too fast. And most importantly, you ask for space to be heard. You can say, "Doctor, I know our time is short today. Can we schedule a longer visit to fully go over this?" That's not confrontational. It's empowered, because you are not just your age. You are not too old or too complicated. You are a woman with knowledge, self-awareness, and the right to proper care. The number on the chart does not define your worth, and it certainly does not decide how seriously you deserve to be taken. There's something especially painful about being told your symptoms are just part of getting older. Not because aging isn't real. It is. The body changes. That's a fact. But when doctors use age as an excuse, it becomes a wall, a way of not looking further, of not asking the right questions, of not truly listening to what your body is trying to say. It often starts with a small phrase. "Well, you're not 30 anymore." Or, "That's just what happens at your age." Harmless on the surface, but underneath, that kind of dismissal can cost people their lives. You come in with fatigue that feels different, deeper, more sudden. They say it's just natural slowing down. You mention that your joints hurt more than usual, or that your balance has changed, and they suggest stretching or rest. You talk about your mood shifting, your sleep changing, your digestion becoming unpredictable, and you're met with a polite smile and a nod that says, "This is just part of aging." But you know your body, and deep down, you know when something isn't just age. I met a man named Carl who lived this very story. 67 years old, former construction supervisor, always active, but for nearly a year, he kept telling his doctor that something felt off. His joints ached in ways they never had before. His hands were stiff. He had to sit down more often than usual. And each time, he heard the same thing. "Carl, you're getting older. Your body's just slowing down." By the time he pushed hard enough for blood work, the truth came out. Severe rheumatoid arthritis, already causing permanent damage. All those months, his joints were being quietly destroyed, while the doctor kept calling it normal aging. And here's the thing, Carl is not alone. Study after study shows that serious conditions in older adults are often attributed to aging before a proper diagnosis is made. 85% of them. 85. That means the majority of dangerous, life-altering illnesses in people over 65 are first ignored because the patient is just getting old. Can you imagine how much damage is done in that time? How many lives are made harder, shorter, more painful? Not because of disease, but because of assumption. This isn't medicine. This is bias. And what's even more troubling is how quickly we start to believe it. You go to a doctor hoping for answers. Instead, you leave with more doubt. You start wondering, maybe it really is just me. You downplay the symptoms. You push through. You stop asking. That's how the system wins. When strong, wise, capable women begin to silence their own intuition. But you can stop that pattern. And it starts with a single, powerful word, evidence. Not medical degrees, not fancy language, just simple, trackable patterns that show what's changed and when. If your sleep has suddenly become disrupted, write it down. If you've started napping in the afternoon after never needing to, record the date it began. If your digestion has changed, your energy dipped, your memory shifted, put it on paper. Turn "I don't feel right" into a timeline, into facts. Because here's what happens when you do that. You remove the excuse, You take the vague out of the conversation. Now, your doctor has to respond, not to age, but to data. And if they still brush it off, ask a simple question. What would you do if I were 40 with these same symptoms? Let them answer. Out loud. In front of you. You'll be surprised how quickly the conversation changes when age is no longer their shield. Sometimes it takes one clear question to break through years of habit. And don't be afraid to say, "That explanation doesn't feel complete to me. What else could be causing this?" You're not challenging their expertise. You're protecting your health. Because the truth is, yes, aging does change the body, but it doesn't erase the possibility of illness. It doesn't mean you stop deserving answers. And it sure as hell doesn't mean you have to accept. That's just what happens at your age. As the end of the conversation, your body is speaking to you for a reason. Your role is to keep speaking on its behalf until someone listens. And when that happens, when you finally get the diagnosis, the treatment, the clarity, you'll know it wasn't just aging after all. It was something real, something that needed attention. And you were right to trust yourself. There's another kind of dismissal that doesn't always come through in words, but you can feel it in the room. It's that moment when the doctor starts speaking just a little slower, when they avoid going into detail, when they use simple phrases that sound more like instructions than conversation. And suddenly, without realizing it, you're no longer being treated as a thinking partner. You're being spoken to like someone who just needs to follow orders, not someone capable of understanding what's really going on. This kind of bias is subtle, but it runs deep. It's the quiet assumption that, because you're older, your mind must be slowing down too, that you won't understand the technical terms, that you'll get overwhelmed by options. That simple is better for you, not because of medical necessity, but because they think that's all you can handle. And what happens when that assumption takes hold? You stop hearing about all your options. You're given the easy version of treatment, even if it's less effective. You're left out of decisions that impact your life in the most direct, personal way. It's not always obvious. Sometimes it looks like kindness, like trying to protect you from worry or stress. But in reality, it's a quiet form of disrespect. It says, "You don't need to know. You wouldn't understand. Let us handle it." But here's what they forget. You've made complex decisions your entire life. You've raised families, managed households, handled finances, worked full-time jobs, juggled caregiving, grief, and growth. You know how to think through options. You know how to ask questions. And you know when someone's holding something back. I'll never forget Louise, a 71-year-old retired chemistry professor, sharp, calm, not afraid to do her own research. She was diagnosed with early-stage breast cancer, and when she sat down with her oncologist, she expected a full discussion of her options. Instead, the doctor said, "At your age, we'll keep things simple. A straightforward mastectomy is best. No need to get into the complicated stuff." Louise was stunned. Not once had he mentioned reconstruction, targeted therapies, or clinical trials, treatments regularly offered to younger women with the exact same diagnosis. And when she asked why, the answer was chilling. "We find that older patients usually don't want to go through all that." He never asked what she wanted. It took months of pushing, second opinions, independent research, meetings with specialists, for Louise to finally receive the full range of options she was entitled to from the very beginning. That experience shook her, not because of the cancer, but because of how quickly the system tried to simplify her out of her own choices. And this is what happens when intelligence is quietly replaced with assumptions. The words may be gentle, the tone may be polite, but the message is the same. You probably can't handle this. Let's make it easier. But easier doesn't always mean better, and it rarely means equal. So how do you stop this kind of age-based simplification before it begins? You lead with what they don't expect: competence. Start every appointment by giving a little context. I used to manage multi-million-dollar projects. I taught nursing students for 20 years. I've been researching treatment protocols on my own. Even just saying, I prefer to hear the full picture before making a decision, sets a powerful tone. Ask questions that show you're thinking beyond the surface. What's the mechanism behind this medication? Are there any targeted therapies available for someone in my condition? If I were 55 with these symptoms, what other treatments would we be discussing? When you use language that expects depth, you get depth. And don't shy away from technology either. Pull up articles. Reference your medical portal. Bring printed materials you've highlighted at home. Not because you need to prove anything, but because you're showing them who you are, engaged, informed, and fully capable. If they still give you oversimplified answers, respond gently but directly. I appreciate you keeping things clear, but I'd like a more detailed explanation. Please walk me through all the options, even the complex ones. I'll let you know if I need clarification. You'd be amazed how quickly the tone shifts when they realize you're not there to be managed. You're there to be included. And let me tell you something else. There is no expiration date on intelligence. There is no age limit on critical thinking. And there is no moment in life when you stop deserving the full truth. Your mind is still sharp. And even if it slows down some days, that doesn't mean you stop understanding. It means you take your time. You ask better questions. You think more carefully. That's not weakness. That's wisdom. So the next time you sense someone is talking down to you, take a breath and speak up. Because you are not someone to be spoken over. You are someone who deserves to be spoken with. There's something deeply unsettling about being medicated for reasons no one says out loud. You go into a medical setting, maybe it's a hospital, a rehab facility, or even a regular appointment, and somewhere along the line, someone hands you a prescription. Sometimes it's for sleep, sometimes for anxiety. Sometimes they call it a mood stabilizer, or they say it will help you relax. It all sounds reasonable, but something in your gut tells you this isn't about healing. It's about control. What's often left unsaid, and sometimes even unknown to the patient, is that these medications are frequently prescribed not because of a clear medical diagnosis, but because they make older adults easier to manage. You speak up too much? You're labeled agitated. You ask too many questions? They say you have anxiety. You want to be included in your own care plan? They decide you're resistant or difficult. And the solution? A pill. But what happens when that pill starts dulling your thinking? When your speech slows down, or your balance gets worse, or your days start blending together and you can't quite remember why? They say it's your age. They say you're declining. They say, this is just part of getting older. But they never say, it could be the medication we gave you. Let me tell you about Beverly. She was 69, recovering from hip surgery, sharp-minded, independent, used to running her own life. But after a few weeks in rehab, she started asking about her timeline. She wanted to know when she'd be walking again, when she'd get her strength back, when she could go home. Perfectly reasonable questions for anyone. But instead of getting answers, she got labeled restless. And within days, she was prescribed a low-dose anti-anxiety medication just to help her adjust. The medication made her dizzy, then confused. Then she fell and broke her wrist. That one prescription turned a straightforward recovery into a 4-month setback. Not because of her hip, not because of her age, but because someone decided it was easier to sedate her than to respect her voice. And sadly, Beverly's story isn't unique. More than 40% of older adults are prescribed at least one psychiatric medication, but only a small fraction of them have been formally diagnosed with any condition that would justify it. Let that sink in. That means millions of older Americans, mostly women, are being chemically quieted, not treated, not helped, just made quieter. It's called chemical restraint, and in too many care settings, it's not an accident. It's a strategy. These drugs can include sedatives, antidepressants, antipsychotics, and sleep aids, and they're often given to patients who are simply, and understandably, upset, confused, afraid, or asking questions no one wants to answer. Sometimes even families request them because they're overwhelmed by the emotional toll of caregiving and don't know what else to do. Sometimes facilities push for them because sedated patients require less staff time. And sometimes doctors prescribe them without explaining the full risks or without a clear medical reason at all. But these medications come with consequences, serious ones: confusion, falls, memory loss, loss of independence, increased risk of death, and even more alarming, once you're on them, it becomes harder to argue why you shouldn't be. You start to seem forgetful, withdrawn, passive, not because of a medical condition, but because of the medication that was meant to calm you. And that can become a vicious cycle, one that pulls people deeper into dependency, not healing. But here's the good news. You're allowed to ask questions. You're allowed to say no. And you're allowed to understand exactly why any medication is being given to you. Start by asking, what specific diagnosis is this medication meant to treat? Follow it with, how will we know if it's working? And what's the plan for stopping it? If the answers are vague, if they say things like, just to help you adjust, or it's common at your age, that's a red flag. You can also ask, what non-drug options are available for what I'm experiencing? Sometimes the answer might be therapy, or environment changes, or just more honest conversation. But you won't hear those options unless you bring them up. And if you're already on one of these medications, don't panic. But do get curious. Look up the name. Ask your pharmacist for a medication review. Talk to a geriatric specialist. Ask if it's still necessary and what alternatives might be safer. Because the truth is, you deserve clarity, you deserve transparency, and you deserve care that supports your healing, not your silence. No one should ever be medicated into invisibility. You are not too emotional. You are not too much. You are a person with feelings, opinions, and the right to be fully present in your own life. So the next time someone hands you a new pill and says, this will help, you have every right to ask, help with what? Help for whom? And is there a better way? There's one last truth we need to talk about, and in many ways, it's the hardest one to accept. Because this isn't just about being misunderstood, or dismissed, or talked down to. This is about being quietly judged as less worthy of saving. It happens behind closed doors, with charts and checkboxes and insurance codes. It happens in meetings where families aren't invited, and in systems that measure lives in numbers, not stories. What they won't tell you is that in many cases, your treatment, or lack of it, is not being determined by your symptoms, your test results, or your will to live. It's being determined by a cold equation. How many good years do you have left? Is it worth the cost? Is it worth the risk? They have a term for it: quality-adjusted life years. And while it may sound clinical or even logical on the surface, here's what it really means. A 70-year-old's life is seen as less valuable than a 40-year-old's, not in terms of love, not in terms of wisdom, but in terms of how much care you'll get. So if you're older and facing a serious diagnosis, cancer, heart failure, organ damage, you may find that the most aggressive treatments, the newest technologies, or the full range of specialists quietly disappear from the table. And unless you know what to look for, you might not even realize it's happening. You'll hear phrases like, "We don't usually recommend that at your age. Let's focus on comfort." Recovery could be difficult for someone in your stage of life. They don't say it cruelly. Sometimes, they even say it with a kind smile. But the message is clear. We've decided how far we're willing to go for you. Walter, a 68-year-old retired engineer, faced that decision firsthand. After being diagnosed with kidney failure, he was quickly steered toward palliative care. Dialysis? Not recommended. They said it was too hard. Too much? Not worth the strain. But Walter knew his body. He knew his strength. And most of all, he knew he wasn't done living. So he fought. He demanded second opinions. He requested access to the same treatments younger patients would receive. He asked the hard questions and refused to back down. Eventually, he started dialysis, and over the next 7 years, he returned to work, traveled, mentored younger engineers, and watched his grandchildren grow. 7 years of life, almost taken from him not by disease, but by assumption. And Walter's story is not rare. What's rare is that he pushed back, because the deeper tragedy is that many seniors don't. After hearing, "You're too old enough times," it starts to sound like the truth. You stop asking for more. You accept less. You let them decide what's appropriate, even when your heart is still fighting to live. But let me say this as clearly as I can. Your life is not less valuable because of your age, and any system that tells you otherwise needs to be questioned, out loud, and without apology. So how do you push back? You start by asking one simple question. Would you recommend the same treatment if I were 45? If the answer is no, ask them to explain, medically, not economically, why that is. You research outcomes for people your age who've undergone the treatments you're being denied. You bring those numbers with you. You show them that older adults do recover, do thrive, do live fully when given the chance. And if one doctor tells you there's no point, find another, and another, if needed. Geriatric specialists in particular understand how to weigh risk and benefit without dismissing your value. You also have the right to ask for full diagnostic testing, even if insurance pushes back. You have the right to request second and third opinions. You have the right to say, "I'm not ready to be written off," because you are not your age. You are your strength, your clarity, your purpose. And those don't disappear with each birthday. They deepen. You've just heard some hard truths, not because you're fragile, but because you're strong enough to face them. Maybe some of these stories felt familiar. Maybe they even hit too close to home. But now, you know what's happening. And more importantly, you know what to do about it. Because when you speak up, ask questions, and stand your ground, you're not just protecting yourself. You're changing how the world treats every woman who comes after you. You still matter. Your voice still carries weight, and your care should always reflect that. Thank you for being here, and for refusing to be silent.